biggest side effects with surgery is incontinence, because the prostate basically sits between the bladder and the urethra, or the drainage tube for urine. So if the prostate's in the middle and it's removed, then you've got to reattach the bladder and the urethra. So most men are incontinent after surgery, and they heal up well over time. And we know it after about 4 to 6 months after surgery that those patients maximum continence is restored. About 10 to 15% of patients, however, depending on the study you look at, will need some sort of incontinence device because their sphincter, or their ability to close off their bladder, is impaired. That's the main downside to surgery. The upside to surgery is that for a lot of people there's peace of mind that their prostate's not there, and we know that if their PSA was elevated before surgery and it goes down after surgery, the likelihood of them being cured is well over 90%. The other good thing about surgery is when we do a biopsy of the prostate, we just get 12 little pieces most of the time. So if someone undergoes surgery, we take the whole prostate, we can section that up, and we can look at it and say, is this the type of prostate cancer we thought it was? The interesting thing is when we've participated in studies and we do that and we compare what's called the pre-surgery biopsy to the surgical specimen, is that 20% of the time it changes. So it gives people more information about their prostate cancer to have surgery, and I always stress that to patients. Radiation therapy, the nice thing about it is there's no risk of surgical complications. It's all outpatient. It's very well tolerated. During those 44 treatments of radiation, men are at risk for some increased frequency of their urine. They're also at risk for some diarrhea, but those are usually managed with either over-the-counter or mild prescription medications. The big risk of radiation therapy is damage to the rectum. The rectum sits right behind the prostate, so there's about a 5 to 10% chance of men having blood in their stools, which usually resolves with conservative management. Occasionally men will have to have a procedure to cauterize those vessels. Radiation from the inside, or prostate seed brachytherapy, places men at risk for urinary obstruction. Basically, the prostate swells and squeezes off the urethra. I think the best way to summarize it is all three of them have a better than 90% cure rate. They all have one major complication that's a 5 to 10% risk. And what that means is 90% of the patients are cured, and 90% of them have a very good quality of life. In terms of sexual function, most men are impotent after surgery, and they usually regain some potency over 2 to 3 years. The degree of potency is really dependent upon their preoperative potency. In other words, people don't ever get more potent after surgery. With radiation therapy, there's no change in sexual function at all. It can occur over time, up to 2 to 3 years later, to have some reduction in potency. Men who get androgen deprivation therapy or hormone therapy, testosterone is the main chemical signal to allow for erections, and so therefore they lose the ability to have erections until that androgen deprivation therapy is removed.